Hi, it's Jeff Heimiller here with Vanderbilt Emergency Medicine. We're going to learn the skill of measuring intraocular pressure, also called ocular tonometry. It is a necessary skill for the correct management of emergency ophthalmology conditions and must be mastered by emergency physicians. Tonometry is the estimation of intraocular pressure, or IOP. Essentially, measuring the degree the cornea deforms when a given pressure is applied to it allows us to estimate the pressure inside the eye. There are several methods of doing this, including the Shiat's tonometer, originally invented in 1905 and still stored in Vanderbilt Trauma Bay 3. You could theoretically just press your finger over the closed eyelid to estimate IOP, but this method should be reserved for ophtho Jedi masters. In the Vanderbilt ED, you'll be using the TonoPen, so that's the one we'll focus on. An IOP greater than 21 is elevated and represents badness. Typically, we're using tonometry in the evaluation of a painful or red eye to assess for glaucoma. Other common situations would be the patient with orbital trauma, where we suspect hyphema or retrobulbar hematoma. Patients with iritis need IOP assessed on repeat visits, so this may be done in the ED or by the ophthalmologist. And don't forget that some acute angle closure glaucoma patients may only present with headache or nausea rather than the typical painful eye, steamy cornea, and mid-fixed pupil. Suspected open globe is an absolute contraindication to tonometry. You don't want to squeeze out any more of that precious eye juice by applying pressure to the cornea. Infection is a relative contraindication, but we address this by using replaceable probe covers on the TonoPen. Corneal defects such as abrasions may be exacerbated by performing tonometry, so consider whether this procedure is necessary or discuss with your ophthalmologist. If a patient is unable to relax, open their eye, and sit still, you're likely to get false readings and may even cause injury by trying to poke someone's eye while they're thrashing about. To perform the procedure, you'll need a TonoPen and a bottle of anesthetic drops. To get ready to take a measurement, first put on a new TonoPen probe cover. Turn the probe on by pressing one time, then follow the calibration procedure for your probe. Apply anesthetic drops to the patient's eye and wait for them to take effect. Press the button on the probe once to activate the TonoPen. You'll see a set of double dashes across the screen. Touch the TonoPen against the center of the cornea, perpendicular to its surface, several times. These taps should be light and brief. Each successful tap will have a click sound, letting you know it was successful. After 4 clicks, you'll hear a beep, which means the probe has obtained enough measurements. The screen now shows your IOP estimate and the likelihood of error. Using a pig eye, I'll highlight a couple pitfalls. Do not apply more pressure than is needed to hear the click. Doing so will deform the cornea, prevent successful measurement, and potentially cause corneal injury. Apply directly over the pupil. Although it's tempting to check measurements around the perimeter of the cornea or even over the sclera, doing so will lead to useless readings. Make sure you're presenting the probe perpendicular to the surface of the cornea. Angling the probe will prevent the entire probe from contacting the cornea and prevent a measurement.